McKee, and I'm going to be performing the skill of nasogastric tube insertion. So first thing I want to do is come to my patient's room, wash my hands, I want to introduce myself, let them know what I'm going to be doing, and provide privacy for them. So the first thing I want to do is I want to check the nasal cavity and see which one's the best. If the patient has any sort of nasal polyps in there, or if they have a deviated septum, I'm going to know that that's not a good nasal cavity to go to. So, just kind of check nasals and figure out which one's the best one there. So next we're going to open our Salem's Clump pumping tube. We're also going to open our anti-reflex, which will go in between our tubing. We'll take this out. Okay. Next I want to measure my tubing on my patient. I want to go from the tip of their nose to the tip of their earlobe down to their xiphoid process. Once I get that, I want to just stick a piece of tape there so I kind of have a good idea of how far to insert the tube. Should be right there. Next I'm going to take some lubrication and I'm just going to lubricate the first couple inches there. We're really only going to do the first 3 to 4 inches. I'm going to also provide my patient with a cup of water, and if we have an assistant, they can also help too. When you're inserting the tube, you want them to start drinking water too. So I'm going to take my patient's head and tip it backwards, and I'm going to insert into the nasal cavity there about 3 to 4 inches, or until they start gagging. Once I get there, I'm going to then start having my patient drink water. I'm going to have a swallow, 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 until you can't get them to go any farther into the nasal cavity there. Swallow, 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 swallow. So I can't go any farther on here, but we would go all the way up to our tape. Once we get to that point, we would never let go of the tubing, we'd hold on to it, and we would take a separate piece of tape, place it over the patient's nose, and kind of wrap it around the tubing just to hold it temporarily. Just hold it there. Next I'm going to take a 60cc syringe here. I'm going to insert about 10 to 5 cc's of air. I want to take my... Basically we're going to be listening for a swooshing sound when we put the air in, just to make sure our tube's in the right place. So we're going to insert the tube, and I'm going to be listening on the fundus, which is just to the left of the xiphoid process. So we're going to insert the air and listen for the swooshing sound. Once we hear that, we know they're in. I'm also going to aspirate some to get some stomach contact out, some fluid there. We'll just unhook that. And then we're going to take that and put it on our pH strip. Just check our pH there. If our pH, we want it to be below 4 to 0. If we know that we get that, then we know that we're in the stomach then. So, once we have that, we know that we're in the stomach, we can take another piece of tape. We just attach it to our patient's tubing. We can take a safety pin, attach that to the patient's gown, just give them some room so that they know that they have some room to move around there, so we do that. We'd also make sure our tape placed right, secure it more firmly on the nose there. And then we would take our suction tubing and turn it on and insert that. Turn our suction on. Because the suctioning brings the tube of the NG tube to the stomach, we want to insert another 5 to 10 cc's of air just to make sure that that's not in the wall of our stomach. So just take and insert another 5 to 10 cc's of air. There. With another clean syringe. So now we have our skill of the NG tube in. So later on we come into the room and we see that the tubing is not suctioning and that they have a distended stomach there. We want to first of all check and see if they, have some sort of blockage. So we would turn off our suctioning, unhook it. We would do, with a clean syringe, we would insert another 10 to 5 cc's of air. We'd listen on our fundus for us swooshing. If we didn't hear that, we'd also want to aspirate. See if we could get any fluid out. Nothing there. We would check our pH, see if we have any. If not, we obviously know we have a blockage. So we get another clean syringe. We would drop 30 cc's of water there. We would unhook, plug it back in, and with one hand holding on, we would basically make a plunger of water there and hopefully clear the blockage and swoosh it out. Once our blockage is cleared, we would then again, we want to insert another 10 to 5 cc's of air. We want to check our fundus, make sure we're in the stomach and we're clear, and then check our pH again too. So we unhook that now, and we can also hook back up our suctioning to our tubing again.